Welcome to this recorded webinar on speech, language and communication development in the early years, and this is part of the SEND Passport. My name is Helen Malik and I work together with Sian Rees as speech and language therapists, part of the All Talk project. So the aims of this webinar are to develop your understanding of speech, language and communication, to help you to develop your knowledge around speech and language delay and different strategies that you can use within your setting, and thinking about also sharing that information with parents, and also for you to reflect on your current practice. So what is it that you're doing yourself and also within your setting, things that are going well, what are your strengths, and also helping you to reflect on areas that you want to develop. So research shows us that 7.6% of children in primary years have developmental language disorder. So this is a language and communication difficulty that's not linked to any other factors such as a learning difficulty or hearing impairment or another developmental difficulty. So this is roughly 2 children in every classroom will have a significant communication difficulty. And we also know from research that in areas of social deprivation, which includes Waltham Forest, roughly 50% of children are starting school with delays in their speech, language and communication skills. And we also know that lots of children are not being identified. And so obviously we know that early identification is really important because it means that we can then put supports and intervention in place, which is much more effective the earlier that we can do that. And we also know that there's a long-term impact of having delays in communication and language skills. This impacts on children's literacy development and also on their behaviour, their emotional development, and also it affects children's later life chances as well. So this slide shows us the building blocks of typical language and communication development. So it's really important to think about all of the different skills that are involved in a child developing their language. Often we might notice that a child isn't talking, but actually there's lots of other things that the child might need to be able to do before they can use language effectively to communicate with other people. So at the bottom of the pyramid we have attention and listening, and this refers to a child's ability to focus and concentrate on activities and also to share their attention with other people. Play and social interaction also develops after attention listening. So it's really important that children have lots of opportunities to play and interact with other people. And it's through those interactions with another adult and with other children that children start to develop their communication skills. Children then need to have good understanding of language before they're able to talk and communicate effectively. So this is about their ability to understand and follow instructions and commands and questions. And then we move into speaking or talking. And this refers to the different words that a child is able to say. So first, children will start off using single words, then their vocabulary will expand. They'll start to say a range of different types of words, so action words, describing words, different concepts, and then they'll start to put words together to use phrases and sentences. And then at the top of the pyramid we have speech sounds. And this refers to the sounds that we make using our tongue, our teeth, our lips, cheeks, palate and vocal cords. and speech intelligibility relates to how easy it is for listeners to understand us. And a fully developed speech sound system is like the icing on the cake. So this comes after children's language and communication develops. Often speech sounds are not fully clear until children start school. And then around this pyramid we have the adult-child interactions that are happening on a daily basis through play and everyday routines. So the child communicates and then the adult responds, tunes into them and responds to them. The child communicates something back, and that's that turn taking that happens, which is really key to developing language and communication. So have a think now about the impact of speech, language and communication difficulties. Imagine a child in your setting who's got difficulties with attention listening, with understanding language and with speaking. What kind of difficulties would they have from day to day? Pause the webinar now and have a think about it. Children's play skills allow us a window into their cognitive development. So it tells us lots of information about a way a child is learning and developing and understanding the world around them. Play is also closely linked to a child's language development. Children move through several different stages of play. Firstly, they will be playing in an exploratory type of way, so looking at things, touching things, mouthing things. Then they will start to play in a relational type of play, so starting to understand how objects relate to each other. So, for example, banging a cup with a spoon or throwing a ball on the floor and looking to see where the ball is gone. Children then start to use pretend play. So first of all, this will be by acting out functional everyday routines they see around them. So for example, pretending to sweep up some rubbish or pushing a dolly around in a pushchair. And then they will start to combine these actions to use more sequences of pretend play. Imaginative play then starts to develop as pretend play skills develop during the second and third year. It begins to contain sequences of events and becomes symbolic in nature and more imaginative. The child now understands that the world is full of symbols, objects, pictures and words. Alongside cognitive play skill development, children begin to allow others to join in with them and play in more of a social way. So initially children will play solitary by themselves, so between the ages of about 0 to 1 years. And then they start to observe other children more and be more interested in what's happening around them and what other children are doing. So usually between the ages of about 1 to 2. And then from about 2 to 3, they start to play alongside. So you would see that parallel play. So children are not always necessarily playing together. So they're not joining in and playing the same game, but they might play alongside. And then they start to play a bit more interactive and cooperatively. So as their social skills and their social play skills develop by the age of about 3 and onwards, children start to play and engage and interact together in more of a social way. It's important to consider children's level of play in order to support their language and their social skills, so that when we are scaffolding and using strategies and interventions, we're able to support the development of their skills. So how do we identify children that have speech, language and communication needs? So the first thing that's important to do is to make lots of observations and consider all areas of the child's language and communication skills. So think back to using the language pyramid. Think about the child's attention and listening, their social interaction and play skills, their understanding of language, their talking, and their speech production. And it's quite common that children in the early years will have difficulties in more than one of those areas. Also think about your own knowledge of typical language and communication development, because that will help you to work out if a child is having difficulties. You can also use a screening tool, so we have an All Talk screening tool as well as your EYFS documentation to help you work out what children should be doing at different ages. Also speak to parents or carers, because they know their children best and they often will be able to share with you lots of information about what the child is doing at home. So talk to them about how their child communicates at home. Does their child use any words? Do they think their child is having any difficulties? And also find information out about their children's language use at home. So especially if a child is speaking more than one language or has a different home language at home, it's really important to find out information about all the languages that are spoken. Also agree some strategies with parents, so things that you're going to put into place that parents can also do at home to help support the child. You can also speak to your area SENCO to get some support and advice, and also refer to the speech and language therapy team. You might also want to think about making other referrals to maybe the educational psychologist and signposts of parents to attend the speech and language therapy drop-ins at the children and family centres. Please also refer to our Tier 1 document on the Hub, which is called Identifying Speech, Language and Communication Difficulties. This will give you some more information. So making a referral to speech and language therapy, if you are referring to the speech therapy service at Wood Street Health Centre, this is part of the Specialist Children's Services, and you will need to use the Specialist Children's Services referral form. Please add as much information to the form as you can about the child's skills and their difficulties, and you can use this form to refer to speech and language therapy and to physiotherapy and occupational therapy, and also to the social and communication clinic, or the SAC clinic, and the child development team. You can also signpost parents to access the speech and language therapy drop-in sessions at the children and family centres. So during the COVID virtual offer, you can still refer families by contacting Henry and completing a referral form, and the speech therapist will then contact the parent. So what can the family expect? So if you're referring a child to the speech and language therapy service at Wood Street Health Centre, the family will be offered an initial assessment within 18 weeks of receiving the referral. The speech and language therapy will do an assessment and speak to parents and gather information, and will complete a report with recommendations. The child might be added to the preschool speech therapy caseload, and then they will go on the waiting list and be invited for some therapy sessions. During COVID, this is currently being offered virtually by teletherapy. The child will also then receive a report with a programme and targets and strategies for nursery. Parents will also be able to access pre-recorded videos with different strategies and activities that they can use at home. And the speech and language therapist might also make onward referrals, possibly to any other services that they think the child might need assessment from, for example, the SAC clinic. So now we're going to think about supporting children with speech, language and communication difficulties. So these are some key things to think about. So often children's progress can be slow, and so it's really important to persevere with any strategies or interventions that you use. It's really important to keep using those for a good 6 to 10 weeks before you review whether they're working or not. Also, lots of children can be variable in how they might respond to the different things that you're doing to support them. So what works one day may not work another day. And also what works for one child may not work for another child. So it's really important to be aware of those things. Also check your targets. So any SEN or speech and language therapy targets that you use, try to make sure that these are really smart, so really specific and measurable and realistic for the child. It may be that you want to consult with the speech and language therapist around those two, so to make sure that what you're working on is going to be achievable. Also think about the child's interests and what motivates them at the moment. So what do they really like doing? What are they interested in? What do they like to play with? What different toys and actions do they like to do? Because these are things that you can then build on in terms of your strategies. And use the strategies across all different environments as well. So this is really important to help the child generalize anything that you might be doing in a one-to-one or small group session. Try and then think about generalizing those skills into other environments and other activities. Also maximize the use of play and everyday routines. That's really important to help generalize children's learning and also to add meaning, and also gives lots of opportunities for repetition of what you're doing. Also think about sharing your knowledge and your skills with the rest of the team in your setting. So this is really important because then it means everybody is going to be working on the same strategies and you are going to be supporting your team to develop their skills and their knowledge. It's important to think about the way that you interact and respond to children. This traffic light image can help us to do that. So first of all, think about stop and listen. This means observing what the child is interested in and what level of language they are using. Wait for them to start the interaction in time rather than you jumping in. And then respond. And when you respond, use commenting, repeating, and expanding. We'll go into this in a bit more detail on the next slides. So what works? When you're playing and interacting with children, it's really important to follow the child's lead. So stopping and observing, waiting and listening. Also try and be face to face. So this supports joint attention and it lets the child know that you are listening and interested in what it is that they're communicating. Imitating, so copying a child, shows them that you're interested. It also means that they're more likely to copy you when you want to scaffold their interaction or play or talking. Interpret or comment rather than question. So questions can often interrupt the flow of a child's thinking and conversation and can disrupt their learning. So instead of asking too many questions, try to comment on what you see so that the child can map the vocabulary on what's happening or what they're doing. So for example, if they were feeding a teddy bear, you might say, "You're feeding a teddy bear." So you're giving them the words rather than testing and asking the question. Also, repeat words and phrases because children need to hear new words several times in lots of different situations so that they can develop really good understanding of what the words mean. Also, emphasize, so stress the words that you want the child to notice. So if they say a word that's slightly wrong, for example, "Look, mouses," you might respond with, "Wow, mice." So you're repeating but modelling the correct way to use the phrase. Also expand on what children say, so add words and ideas to what the child is saying. For example, if a child says bus, you could respond with, "Yes, a big bus." So we know that communication happens throughout the day in everything that we're doing. So everyday routines are a fantastic way to develop language and communication. There's lots of different things that you can do to model during these activities. And because these routines are happening every day, it gives lots of opportunities for repetition in a natural, functional way. So think about slowing down that routine. So if you have got a routine that children really enjoy, slow it down and give extra time. Children who have difficulties with language and communication often need longer to process what it is that's happening around them, what's been said to them, and also they need longer to generate their response. So giving extra time is really important. Also give reasons to communicate. So you might offer choices or you might sabotage what it is that you're doing, maybe by putting things out of reach or in a cupboard or in a box. So this is all different ways of giving opportunities for your child to communicate with you. Use repetition. So think about the language that you're modelling in those routines and trying to repeat those key words and phrases. And also remember to be careful with questions. So if you are asking questions, try to make them genuine, not testing questions. Some children might benefit from some small group time to practice their attention and listening and interaction and language skills. So if you are running any small groups, here are some top tips to think about. So think about keeping the group short. So often children find it difficult to focus and engage for long periods of time. So short activities often work much better. Also think about the size of your group. So it's much better often to have a smaller group with just a few children than maybe a larger group where it takes longer for children to have to wait for their turn and they're more likely to get distracted. Also, keep the activities interesting. So it's really important to think about what do the children like to talk about, what are they interested in, and try and use lots of props such as puppets and real objects, things that they can touch and feel, things that are going to be interesting to talk and communicate about. Keep the activities moving as well. So try not to spend too long on an activity. Think about activities where maybe they have to stand up and move around. And also think about using songs and rhymes to help keep their interest. And try and keep it inclusive. So try to make sure that everybody in the group has an opportunity to join in and communicate. This slide gives us some information about how we understand information. So if we think about somebody talking to us, only 7% of our understanding we get from what they're actually saying, so from the words. 38% of our understanding comes from the intonation that they use or the way that they're saying things. So for example, if they're saying they're fine in a happy way, I'm fine, or I'm fine in an angry way. So a lot more of the information comes from that intonation, and 55% of the information comes from their body language and their gestures and all of those visual cues that they will be using when they're talking to us. So their facial expressions, their pointing, their body language. So all children benefit from using that visual support as well to support their understanding of what we're saying. So think about the kind of visual support that you're using in your setting to support children's understanding and use of language and communication. So there is a hierarchy in terms of using visual support to help us think about the child's level of understanding. So for example, objects will be at the bottom of the hierarchy, moving through to gestures, photos, symbols, and then the spoken word. So objects are often much easier to understand compared to a photo or a symbol. So if you are using photos or symbols in your setting and the child doesn't seem to recognise or understand the image, it may be that you can try using something that will be easier to understand. So, for example, an object. You can also use visual schedules to support children's understanding of what's happening throughout the day or within a specific activity, and also other kind of visual support strategies. So, for example, sand timers can be useful to help children with waiting and taking turns. We are now reaching the end of this webinar. Pause the webinar now and think about, what do you feel that you have learned from today? How will you share this knowledge that you have learnt with your team? And what will you change or try out in your setting? Here are some links to some websites which have some additional resources around speech, language and communication development and supporting children that have difficulties. Thank you for listening to the webinar today, and look out for more training that we are offering via the traded services, and you can contact myself and Sian as part of the All Talk project using this email, and also have a look on our Facebook page where we share lots of information around supporting communication and language in the early years.